For a few weeks, I have felt a sort of lump and occasionally some trainers, and it's getting uncomfortable when I sit. Yes, you are likely referring to pilonidal disease, which is a chronic skin condition that happens at the base of your spine in the gap between the top of your buttocks or your natal cleft. In many cases, there's a cyst or a sinus that contains hair, skin debris, or fluid. Some people just have the pit or sinus with no symptoms. Others have the infections or abscess. A pilonidal abscess is very painful and needs medical treatment. So it's not just a boil? Right, it's similar in that an infection may occur, but the origins is often different. Hair or debris penetrating the skin, forming a tract, then becoming infected. What causes it? We are not sure why pilonidal disease happens, but it may be due to being born with a small dimple in the area and damaged hair follicles that poke into your skin. Some other things such as having curly or coarse body hair around your buttocks, family history, being overweight, poor hygiene, sitting for a long period of time, or repeated frictions to the area causing increased sweating, and some other skin conditions are more likely to make this happening. And what are the symptoms? A pilonidal sinus may cause no symptoms, though you might see a small pit or dimple in the crease between your buttocks, or some clear fluid drainage. If a cyst is formed, you may feel a small, usually painless lump, sometimes more than one if it's long-standing. You often notice pilonidal disease only when it's become infected, leading to a painful lump or swelling near the tailbone, redness, tenderness, or a pus-filled abscess, pain when sitting or moving, sometimes a fever. See your doctors if you have these symptoms for proper treatment. How is it treated? If you have a pilonidal cyst without an abscess but are having symptoms, your doctor may refer you for surgical treatments. There are several types of surgery. Your surgeon will give you details for each one. Contact your doctor right away if you develop an abscess with pain, swelling, discharge, or a fever. You're likely to be referred to a surgeon for treatments, which usually involves draining the abscess. Antibiotics may be prescribed if you are unwell, have a heart valve disease, or are immunosuppressed. It is also important to take pain medications as needed during your recovery. What can I do to care for myself? If you have pilonidal disease without any symptoms, you may not need treatment, but it is important to reduce the chance of it getting worse by keeping the area clean, avoid tight clothing that increase frictions or sweating, and for healthy weight, regularly remove hair from that area, stop smoking if you smoke. That was so helpful. Follow Selenethenurse to learn more about your health.